Hi. There's a lot of misconceptions out there about adult acquired flat foot or adults that have painful flat feet or tendons that have given out in a condition called posterior tibial tendon dysfunction. There's a lot of misconceptions out there also about what podiatrists do and what orthopedic surgeons do. Now, there are some excellent podiatrists that do reconstructive surgery. There's some excellent podiatrists that do foot surgery. There's some excellent podiatrists who don't do any surgery. So there's a lot of differences and variation in training. My specialty is reconstructive surgery of the rearfoot ankle, but I also do general podiatry. And the reason why I think we should address that is because I've seen and heard a lot of patients come in to my office say, hey, my other podiatrist said nobody in this town or this area can handle my condition, or no other podiatrist can handle my condition. I have to go see a foot and ankle orthopedic surgeon. And this is from my own colleagues, whether it's from the lack of education of my older colleagues as to what our new training protocol is for podiatrists is, or just as a just plain old competition wanting to refer patients away from the field so they don't look inadequate. This is something that's a problem in our field. Now, orthopedic surgeons, they come varying good and bad, as everybody has their good and bad. You have some excellent foot and ankle orthopedic surgeon, and you have some not very good. So it's about the individual. So to classify a doctor just by their degree, as far when it comes to reconstructive ankle surgery, is not so easy. I will say the best way to assess that is the doctor's track record. Um, have they been around for a while? Have they done enough reconstructive surgery? What are the results? I am open to sharing my results with the general public, hence my copious amounts of videos as you see on Google Plus as well as YouTube. I want to share with you the diversity of cases that I do and the benefits we could provide to our patients that you might not get elsewhere, where you could be misled. So these are some couple cases about adult reconstructive flat foot procedures from a patient that is 80 years old and another patient that is a 46-year-old. Both happened for different reasons, but end of the day, severe ankle pain, flattening of the foot, flattening of the arches, and inability to walk, inability to wear braces. This is when we undergo surgery. Sometimes braces are sufficient. That is the actual gold standard for non-surgical care, is putting patients in a custom brace. We offer that also. So listen to our patients, see what they have to say, and definitely look forward to hearing from you. If you have adult acquired flat foot or posterior tibial tendon dysfunction, I also deal with pediatric and adult flat foot. We treat pediatrics differently. This video illustrates two patients with adult acquired flat foot, one in their 40s and one in their 80s. Again, both for different reasons, for the same etiology, and same surgical procedure was chosen with excellent results. Thank you. This is a patient with double arthrodesis. This is the incision on the medial side. But also there was a posterior tibial tendon repair too, hence the incision going a little bit higher. We're going to take a look at this side. She's about 4 months out of surgery right now. Let's bring your knee up. Do me a favor, move that ankle up and around in a circle. Up and around. Any limitation or ankle range of motion?
No,
How much pain do you have?
very little.
How much pain did you have before surgery?
Oh, excruciating.
You were begging for the surgery. You had a big
Yes.
lump and a bump here too that we took down. So
Brought tears to my eyes.
are you happy with the results so far?
Oh, yes.
Yeah. Any advice for people who are thinking about this surgery, thinking that we're going to limit too much range of motion?
Don't wait too long.
That is correct. Look, that range of motion is perfect. That range of motion is coming from the ankle, not from the talonavicular or the subtalar joint. Now, as you can see, this is done via the one-sided approach versus the double approach, which is typically done. The purpose behind the single approach versus double approach is the single approach allows us to access both joints through one incision, less healing time and less complications, as well as better exposure for the surgeon who's familiar with doing that double incision. Single incision versus double incision. Double incision will entail the same incision on this side, but also an incision on this side too, which you see there's no incision over here, and the swelling is wonderful. So we took out one possibility of complication from this surgery by making only one incision for this procedure. Patient's been walking in cam boot with zero pain at this moment. As you can see, the swelling is awesome. She does not have any. Let's take a look at the x-rays. This is that same patient that we looked at before for double arthrodesis. She's 80 years old. This is 4 months out. This is the double arthrodesis, able to access this double arthrodesis site through one incision. This is the fusion. Notice the osseous healing. This is the same exact patient from the AP and oblique view. Notice the washer for the screw in order to obtain the proper purchase of that screw, secondary to her being 80 years old and having non-proper weight bearing on the navicular, talonavicular joint for some time. So we did have some difficulty in having proper screw purchased, but the washer helped to hold the arthrodesis in sight in position, and as you can see, arthrodesis has progressed exceedingly well, with the talonavicular joint completely fused. Calcaneal cuboid joint is in proper alignment. This is a complete weight-bearing views. 48-year-old female with a history of tarsal tunnel syndrome, as well as collapse of the foot. It was a severe collapsed foot. Could not tolerate a AFO, although you did wear AFO for about a couple years, right?
Right, 2.5.
2.5 years. So here she is. We did a tarsal tunnel release. She was having nerve symptoms down the medial ankle. This is the incision. The incision for a double arthrodesis usually goes from here to here. I had to extend it more proximally on this end, just so we can go ahead and release the tarsal tunnel as well as repair the posterior tibial tendon. Again, this is all the scar. There's no scar on the lateral aspect. This is a single incision double arthrodesis. We are at about 4 months post-op on this patient right here, and she has no pain.
Nope.
She's been walking around, no tingling or burning sensation like you had before surgery. Am I correct?
Yeah.
Can you move your ankle up and down? A lot of people are afraid of being stuck, but you're really not stuck when we do a double arthrodesis.
I have been doing my own little bit of therapy at home to help get through the day.
No, it looks good. Your bone have been looking good. Any tips for people who are anticipating surgery or are scared of the surgery?
They shouldn't really be scared of the surgery, and they should talk to the doctor a little extra effort about it to make sure they know everything before surgery so they don't get too scared.
Okay.
And the doctor will work a little extra time to make sure if you have any doubts or fears.
And obviously experience of the doctor doing the surgery too.
Right.
Makes a huge difference in the outcome.
And sometimes a second opinion is better than a first opinion.
Was that your second opinion?
Yeah, because the first guy was worse.
What did the first guy tell you?
Dr. Goodman, he said I just had fasciitis pain, take a mild muscle relaxant and go to yoga.
Yeah, well, yoga would not help that.
Your
foot
I told him there was something more going on than that.
Your foot was your ankle and foot was in a progressive collapse.
Yeah, he just billed the insurance company and didn't really want to deal with it, so I got a better doctor.
Well, we can't help with that, but we did fix your problem.
Yeah,
I'm very happy you've done well. I'm gonna get you an ankle brace today and get you out of that boot today. How's that sound?
All right, that's good. Yes, and I'm healing about 3 weeks sooner than I expected.
I think you are. You've actually surprised me with your healing.
Yeah.
You've done very well.
Yeah.
So
I did everything you told me to do, right down to the T.
Great. Well, you've been an excellent patient, my friend.
Uh-huh.
I'll show you X-rays and talk about that.
A little impatient at times with the cast, but I was fine.
Overall, the outcome is great.
Yep.
This is the same patient. This is double arthrodesis again. This is a single screw to talonavicular joint. Also, there was a posterior tibial tendon repair. There was a tibialis externum on the side, extra piece of bone. This is 2 screws again fixating the subtalar joint, as you can see. She has progressed faster than I expected, and she has some good fusion
right across those sites. This is the same patient. This is double arthrodesis again. This is single screw the talonavicular joint. Also, there was a posterior tibial tendon repair. There was a tibialis sternum on the side, extra piece of bone. This is 2 screws again fixating the subtalar joint, as you can see. She has progressed faster than I expected, and she has some good fusion right across those sites.